I think when patients are in my office, they're wondering why I'm so concerned about this, especially when they may not be feeling anything. But we know that type 2 diabetes also affects the major organs in our body, like our heart and our kidneys. It can affect the eyes, it can affect your mood.
We know that to prevent certain complications, particularly heart complications, it involves managing glucose, blood pressure, cholesterol, exercise, many different aspects of the lifestyle to really hammer home the point that this is a complication we want to prevent in the long term. Patients need to understand that to manage diabetes holistically, it involves understanding that blood glucose can damage many different organs in their body. And that's not going to happen right away. That's going to take a long time before some of those complications develop, but they'll develop with no signs or symptoms until often it's too late. Blood glucose does damage over time. So the quicker you can get it under control with newer and more effective medicines, the better. So in my practice, what always tends to come up at each and every visit is that they don't understand why is my blood glucose increasing in spite of the same lifestyle, the same exercise habits, and the same medications. It's a progressive condition. It's why often you need more medications, and it has nothing to do with their motivation or the efforts. It's the biology of the disease.
I think the other thing we have to consider when we're having these conversations is the rise of social media. And unfortunately with that, the rise of misinformation. So sometimes our conversations are not just, here are the risks, what can we do? It's often incorporating what the patients are hearing from other sources and trying to make sure that they have an educated, informed opinion or knowledge of what they're doing and why we're doing it. For my patients, I really like to engage with them on making dietary changes, incorporating physical activity at the level they're at and building from there. Patients spend less than 1% of their time with us. So the more they can identify things at home that are either helping their diabetes or negatively impacting their diabetes and respond to those on their own, then the better those outcomes are going to be. My biggest takeaway for my patients always is that you are the steward of your own health. You are the one in charge. And if you make a bad decision, just keep getting back on track.